Two important masks which are being used for the protection against COVID-19 are, one is a surgical mask, another is the most specific, which is the N95 mask. So this is actually the surgical mask, and it has got two surfaces. One is the inward surface and other one is the outward surface. So the inward surface is a little bit lighter in color. As you can see, this is the inward surface, which is a little bit lighter in color. And this is the outward surface, which is a little bit darker in color. So how you gonna apply this mask onto your skin is important. First, you have to wash your hands. You can do it with soap or water, or you can, if the hand sanitizer is available, alcohol-based sanitizer, you can use it. And after that, you have to identify the perfect side of your mask. Then you have to pinch it with the help of your thumb. So you have to keep your fingers outwards and you have to keep your thumb inward and you have to push it from inside out. And then this is just to create a space for the bridge of your nose. And then you have to apply this onto your bridge of the nose. And then you have to use both of your hands to just fit it onto the bridge of your nose. Then you have to hold the sides and you have to go all the way behind your ear. And then keeping this in place, you have to go and bring it to the right side of the ear. And then you have to cover the whole surface, which is the chin, and the sides, which is the angles of your mandibles. And then you have to push it once again and you have to pinch your nose, which is very much important so that the space available for the entry of the air is minimized, because most importantly, it is a kind of a droplet infection and it spreads through the air droplets, so they can get entry anywhere. And after you're done with that, and these are basically the disposable masks, and if you want to get and their use is no more required, then you have to dispose them off and you have to throw them in the garbage. And the correct method is, again, you have to stabilize this and you don't have to touch the surface again and again. You just have to stabilize this, the pinch of the nose, just get rid of the right side like this and just get rid of the other side like this. And then you have to hold the nose like this. You don't have to touch the whole of the mask, and you just have to throw it in the trash wherever is available for you. And then after doing that, you have to wash your hands thoroughly with a soap and a hand sanitizer. There is another type of the soap, another type of the mask which is being used for the protection of the COVID-19, and it is a very specific mask, and especially it should be used by the healthcare providers and the doctors and those who are working in such an environment. There is more exposure to COVID-19. So that particular mask is called as N95 mask. As you can see, this is the lower surface of the mask, and this is the upper metallic surface. So I can actually feel the metal plate inside it. And again, the technique for applying the mask remains the same, but as compared to the simple surgical mask, it has got two straps. So this is the upper strap and this is the lower strap. And what you're gonna do is you have to use this, or you have to place this lower strap on the nape of your neck, and this upper strap should come at the back of your head. That is the occiput, okay? So again, you have to hold the mask like this, and before doing the same principle would be applied. Wash your hands thoroughly with the soap and water, or if alcohol-based sanitizer is available. And then you have to just pull this strap down and pull this strap up, because you have to go all the way and you have to apply the mask in a way like this. First, try to fit in the mask if it's appropriate to your size, just like this, okay? So that means the size is okay for me. And then I have to hold it like this all the way. One is coming down to my nape of the neck, and other one is coming. I have to stabilize this here, and then this mask is coming all the way to the occiput, just behind my ears. And then I have to hold it all the way like this, and then this lower part of the chin and the mandibles, they should be covered appropriately. And this upper strap, which was here, it should go all the way behind my ear, behind my ears, and it should be around the nape, just above the nape of the neck, okay? And so the one strap is going down to the neck, and the other strap is behind the back of the head, that is the occipital region. Okay, so this is the correct way, and you should pinch your nose all the way, and these are the sides, because this is the most vulnerable area to get the droplet infected. And the lower sides and the angle of the mandible, they should be covered properly, okay? And similarly, the process remains the same if you want to get dispose of this. First, remove the one strap, okay, and hold the mask from outside, okay, and then just take the other strap like this, and then you can just hold it like this and you can dispose it off. So it is a proper N95 mask which is being used for the protection especially, but both masks, which are the surgical mask and the N95, these are meant to be protected against the COVID-19. Any type of the other mask, like the cloth mask or the simple, the knitted mask, the blackish in color with the small nets, they have zero protection because they have porous surfaces, and these 500, the size of this virus is about 500 millimeter, okay? So it can goes all the way from those porous surfaces into the surface. So stay protected and try to help others in the case of COVID-19. Thank you.